Good afternoon, ladies and gentlemen, and thank you for tuning in today. As of today, we have no new cases, leaving our total confirmed case count at 89. This process has been a balancing act for us and a difficult balancing act most every step of the way. But it's becoming less difficult. We know a lot more today than when we did when this thing first started, and by and large, the conditions we anticipated a few weeks ago have not materialized, which is absolutely wonderful news. We continue to have local orders in place requiring social distancing and that sick people stay home, and we'll need to closely monitor our local data in the week ahead, especially if some reports about large gatherings over the weekend were true. But what we've seen up until now is that COVID-19 in Victoria County has not been severe. The fact is, even with Victoria County's number of confirmed cases being large compared to some other counties, the result here, the effect here, is that currently 12 people are in the hospital with COVID and 3 are in ICU, numbers that our hospitals are able to accommodate. This is a fluid situation. Things do change, and we constantly monitor every new detail every day. But as of this moment, the data bears out that in Victoria County, you're more likely to die from a car wreck driving down Navarro than from COVID-19. You're more likely to die from just about anything than from COVID-19. Now, certain folks are more at risk than others, and we will consider that fact in everything we do, putting most emphasis on protecting the vulnerable, the elderly, and the sick. I am still looking at the end of this month, May 1st, as a key date to get things back up and running. On Friday, 2 days from today, the governor will announce his plan to restart the Texas economy. That announcement is important to us because Victoria County isn't an island. We are very much a part of our regional and statewide economy. And I don't know what the details of the governor's plan will be, but one thing is certain. We can't let our effort to slow the spread of COVID-19 become the enemy of everything else that we value. We face other public health issues, and other public health issues can in fact be worsened by an inappropriate response to COVID-19, whether that's doing too much or too little, too early or too late. This is one reason why our decisions have weighed so heavily on me, and I know the mayor feels the same way about every decision that we make. One example of those other public health issues, I spoke to a Victoria County resident yesterday who goes in fairly regularly for cortisone injections to deal with severe back pain. Given the shutdown of, quote, elective medical procedures, he hasn't been able to do that recently as he normally does, and has been instead sent home with an opioid prescription to get through the pain as best he can until he can get the next injection. That's but one example of many, many other examples that people in our community could share. And that's something that also has to be weighed into this response. There are legitimate questions about seeing a reoccurrence of COVID if preventative efforts are slowed down too early, and those are legitimate concerns, but most of what we're hearing is that regardless of the response, we'll see some reemergence of COVID-19 down the road to some extent, as viruses typically do reoccur. For the near term, we believe that our local efforts of social distancing and keeping sick people at home and the common sense adherence to CDC guidelines effectively address the conditions we have in our community. And we'll be eager to hear what the governor's plan is so that we can weigh that along with our own local data to make sure the next step we take is the appropriate one for our community. But again, I am looking at the end of the month, May 1st, as a key date to get things up and running again. A couple other items I wanted to share with you. As we have announced, these press briefings will be held Mondays, Wednesdays, and Fridays at 3 o'clock. The reason why we moved to 3 days a week instead of 5 days was because every day that we have a press briefing, it takes a commitment of time and effort from our epidemiologist, our health department director, our health authority, limited time that they have that they're not working with patients, where they're not compiling data. So given the fact that on a lot of days there's not anything big really or new compared to the news we've been giving all along, we felt that we could continue to convey important information to the public doing this 3 days a week. But also keep in mind, we'll still be doing the daily 5 o'clock updates with the most accurate counts. Plus, if the need arises, we can have a press briefing any day of the week or do a Facebook video to put on our Facebook page. The change in scheduling for our press briefings doesn't change the pertinent information that we're able to get out to the community. That'll be continuing as before. Speaking of our press briefings, from the time we activated this Emergency Operations Center on March 13th, we have really set a standard in terms of public communication in dealing with COVID. There are many cities and counties far larger than Victoria that have not done this as frequently as we have. Our hotline itself, with our hotline, we've taken nearly 3,000 calls from the public from when we first activated this Emergency Operations Center. So we have placed an emphasis on public communication, and we'll continue to do so with a slightly adjusted press conference schedule. Again, 0 new cases today, 89 total cases. And with those remarks, I'll turn things over to Mayor McCoy.
Okay. Well, thank you, Judge. I would like to speak a little bit about the numbers that we've been seeing. I think there's been recent reports looking at numbers and comparing us to other entities and other areas of the state. As our epidemiologist has said, you need to be careful because the circumstances of each county's number of tests, the social distancing behaviors, the geographic landscape, patient conditions vary from county to county. So we do not want to compare ourselves too closely, but there are things that I think are pertinent in comparisons. And I think you need to be very careful in not just using numbers. In one instance, comparing a number per county and then comparing another number within the analysis as a per capita number. I think the most telling numbers are per capita numbers when you look at it. And so Victoria is currently based third in the state per capita for testing. We've tested roughly 1.14% of our population. Since the testing rates are higher than other areas, it is very likely that this has led to our higher case counts. The more testing, the more cases you will uncover. The testing per capita across the state in comparison is 0.52%, which means our testing is more than twice the state average per capita. Compared to communities like Corpus, our testing rate per capita is 3.5 times higher than it is in Nueces County, which will, of course, lead to higher numbers of confirmed cases statistically. Currently, Victoria is sitting at about 0.097 of COVID cases per capita, or roughly 1 out of 1,000, while the state average is half that, or roughly 0.053%. However, if you take out the number of cases attributable to our PAM outbreak, our per capita number drops to about 0.059%, which is close in line to the state average. Now, speaking about the PAM outbreak and its significance, I read a comment that was in the comments on the Advocate article last night that said, well, other areas have had outbreaks in health facilities, nursing homes, and everything. Our PAM outbreak counted to as 39.3% of our cases. That's that's roughly 40% of our cases attributable to that one area. If you would apply that percentage to, say, Dallas County, that has a population, I think, of between 2.5 and 2.6 million, that would mean that 40% of their cases would be attributable to outbreaks in facilities. That would be in the millions. So I doubt if they have that many cases in nursing homes and stuff. So you have to look at these numbers in perspective in that way. So I think that PAM did have a significant impact on our numbers, but we have to understand those numbers, and that's why we go to great lengths to statistically understand where we are in this. So when you combine that fact, and another important factor for our county is combined this with the fact that our recovery rate of our confirmed cases, and it just changed because we learned there were some more just before we came in here, is right now at 44.9% of our cases we've had recovery rates, and that's a significant number of recoveries. I personally think it might be attributable, and I'm not going to ascribe this to any health disease. I kind of seem to think the more testing you do that we did based on PAM, you were likely to have tested more people who would not have presented themselves for testing had it not been in the caution of finding people associated with that. So that's going to lead you, in my opinion, to probably testing people who had very mild cases of COVID or were asymptomatic, didn't even know they had it. And that could maybe be the reason why we see such a higher recovery rate than you see elsewhere. It's this type of analysis that we try to make when we read the numbers. We don't take them at face value because we have to make some sense of them, because it will be a component that will be in the judge and I's mind as we start trying to reopen our city, and to do it quickly but cautiously, and do it based upon facts. And I'll share a few other numbers with you comparing our county to the state. And these numbers our population numbers are based on 2019 census estimates. The number of tests in the state of Texas is 151,810. The number of tests in Victoria is 1,050. That's a number per capita in the state of 0.52%. In Victoria, it's 1.14%, double the state average. The positive cases as a percentage of testing, which I find amazing, is in the state level is 10.88%. As a percentage in Victoria, it's only 8.48% of positives. So we're doing well there. The PAM outbreak, if you look at its significance, the positive cases per capita on the state is 0.053. With the PAM numbers, it is in Victoria is 0.097. But without PAM, it's 0.059, which tracks pretty closely to the regular state average. The current hospital cases totals in Texas are 10.52. We have a slightly higher uptick of that of 13.48%. The current hospitalized case per capita, though, is roughly statistically the same, 0.01. The fatalities in total cases in the state of Texas is 2.35%. Our rate is 1.12% with our one fatality. So the fatalities per capita are really in the state, it's 0.001255. In Victoria, it's 0.01086. Our recovery, though, this is a huge difference. The recovery rate in the state of Texas is 20.33%. The recovery rate in Victoria is 44.9%. That's a significant difference. And the recovery per capita in the state is 0.0109. And with our new numbers, our per capita recovery rate is 0.043. So again, significantly higher than the state. And I don't want to single out Nueces County. It's just a county that I've read people comparing us to on Facebook and other places. But if you do a comparison to Nueces County, and this was information that we took off the Nueces County website as of yesterday. Their census estimates for their population is 362,294. Ours is 92,084. The number of tests in Victoria is 1,050. The number of tests in Nueces County is 1,175. The test per capita in Victoria, like I said earlier, is 1.14%. The rate in Nueces County is 0.32%. The positive test versus tested in Victoria is 8.9% versus 7.06% in Nueces County. The positive cases per capita are 0.097% as compared to 0.023%. And the fatalities versus total testing, we're at 0.1. They're at 0 because I don't think they've had a fatality yet. So these are what numbers show us, and these are how we tend to want to analyze the numbers as they come to us. So we try to make the numbers meaningful to what our task is trying to understand the severity of our outbreak and understand it in as it is relative to what we were thinking about doing in getting our economy moving. So it's one of the important factors that we consider is a proper analysis of these numbers. So sometimes when you look at the raw numbers, they can look daunting, but when you analyze them, they're not so bad. So that's the way that we have chosen to use numbers, and we will be doing this on a daily basis moving forward to where we have an understanding and that the judge and I can fold that into our thought process as we move forward to opening up Victoria again. Okay? So with that, are there any questions?
Mayor McCoy, you said there's been 1,050 tests. As of what date was that?
That is of like today.
That would be earlier this morning.
Earlier
yeah.
this morning, yes.
Okay, great. Mayor or Judge, whoever would like to answer, you said there's been 12 county residents hospitalized, and of those 12, there's 3 in the ICU. Is that correct?
Currently, we have 12 hospitalized, and
Right.
of that 12, 3 are in ICU.
Okay,
Yes,
and
ma'am.
that does not include the 10 Pam North patients who are obviously already in the Pam North Hospital with COVID.
I don't believe, though, well, I don't want to tell you wrong. I'd have to check. I know that I had asked that, every morning I asked that specific question. This morning it was 12, the number's 12. Where they are, I don't have that information.
And do we have a total estimate for how many both county and non-county residents are in local hospitals with COVID?
I don't know about the out-of-county numbers. I know of the Victoria County cases, that's 12.
Okay.
Right.
Mhm.
I might
Yes,
have
ma'am.
missed it, but do you have a schedule for when Governor Abbott is going to come and live and make an announcement?
We know it's Friday. There's no time announced. If you find out, please let us know. We typically that's announced the day before it actually happens, but that is Friday, and that's meaningful for us because, like we've talked about, Victoria County is very much a part of the state economy, and it'll be real impactful what the governor does or does not do in terms of applying things statewide. Early on in this process, the approach largely was letting the local officials decide what's best for their communities. Then there was a statewide order that applied to every jurisdiction in the state and, in fact, prevented local jurisdictions from doing anything other than that. And now it seems we're going towards the approach of letting local jurisdictions decide. So we'll see on Friday. I'm very eager to see what those details are.
But that is why we're preparing ourselves with adequate information so that we can move forward in a very responsible way if it comes to us to determine when we start opening Victoria up again. Okay?
Because that was my second question, which is, for the first time I've seen where city officials can change and amend certain orders. But remember in the beginning you could go one way but you couldn't go the other. Like you could add some things that were essential. For this, where do you think you lie, flexible wise?
We'll know better on Friday. And it has not been consistent. Like I say, early on it was, and to a large extent appropriately so, where individual jurisdictions did what's best for their jurisdiction. But as we all know, in the current executive order, counties and cities are specifically prevented from doing anything inconsistent with that statewide mandate. So I don't know what to anticipate on Friday, but regardless of which direction it goes, it will impact what we do locally. In my mind, the biggest and most important consideration are our local conditions, more so than following along with orders from the state. We look at our local numbers, our local healthcare infrastructure, direction and advice of our epidemiologists and healthcare professionals. So we'll see Friday. I don't know what to guess on that.
But like I said, what the judge and I are trying to do is arm ourselves with as much accurate and trustworthy information as we can. If that decision comes to us, then we're going to take the action that we deem appropriate with the knowledge that we have of the conditions in our community.
Yeah, and I think there are definitely steps that can be taken and changes that can be made that appropriately address the public health concerns, but also better accommodate local businesses that are hurting. I think there are definitely changes that can be made to better accommodate the business community. I'm optimistic we'll see and hear details that are in line with that effort on Friday. Yes, ma'am.
Just a question, because we're talking about reopening the economy here in Victoria and all the small businesses. Are we prepared to possibly shut down and re-quarantine again if we do see a spike in that because of people getting back out in the community?
We'll deal with that when it presents itself. It's always the thing about any planning is you always hope for the best, but you plan for the worst. And that's a pretty universal way to handle all planning. And so we're prepared to do, and I said it last week, I think that we are prepared to do whatever is necessary to protect our community. And again, Judge, I don't want to put words in your mouth, but that's the way I look at it. Whatever is necessary to protect our community is my first and foremost job.
And I would add on to that, kind of in line with a comment I made earlier, where regardless of the approach that we take, what we do or don't do. I think we'll see reoccurrence of COVID down the road, some cyclical reemergence of it down the road. I don't think that that'll necessitate or necessarily lead to a lot of the steps that you've seen up until now. As we get more information about this, as the medical healthcare community is better able to understand and adapt to it, and we learn more about it, I think the steps taken that you've seen will be less necessary. I couldn't imagine a scenario where it'd be feasible or advantageous to shut things down, shut down an economy anytime there's a virus that reoccurs. I mean, COVID-19 is not the only virus out there right now. It's not the only virus that's putting people in the hospital. So I would hope that that's not the case, but we would just have to see. I mean, I think like I had mentioned, we know far more today than we did a few weeks ago, and that balance of public health and the economy of local business, I see it as less of a competing interest, a competition between the two, and more of a situation where we can and should address both concerns, both issues. The economy needs to get up and running again. People are hurting. And you see that it's not just an economic concern. It's a public health concern when people lose their jobs, lose their insurance, and face the whole host of undesirable social outcomes that's associated with heightened unemployment numbers. So that's very much a concern too, and I think that's becoming more and more on the forefront of what people are thinking these days, and appropriately so.
Yeah, I think there's a valid argument that people are ignoring their general health because of fear to go seek their normal health care because of fear. And so, like the judge said, that is a health issue. That's abnormal. That shouldn't be, and they're going to suffer for that beyond what COVID would necessarily do to them. And I think we're all know a lot more about this because this is a novel virus, and all the models that were put in place, they're mathematical models, but they're only as valid as the information put into them. And I think it's pretty general when I look and look at different national news sources that the catastrophic predictions made early on are not as catastrophic anymore. And so I think that everybody's adjusting to the possibility of we need to, and I see that in governors all across the United States from different political positions and everything are coming to kind of a realization that we need to start reacting to the realization of what we're facing, not some fear of the unknown. And so I think we take quantum leaps in our understanding of this virus on a weekly and daily basis. There's labs doing feverish work to develop medicines for this. There's labs doing feverish work to bring a vaccine to us as quickly as possible. There's this rapid test, when it's fully put out, is going to be a game changer. I think Dr. Neal has even said that. So things are happening very rapidly, and we keep up with it on a daily basis. And even though we don't have these press briefings as often for the reasons the judge stated, we still have policy meetings. We still discuss everything every morning. So we're not taking a break from it like you would think. It's on our minds on a daily basis. So that's kind of where we are. We'll continue to analyze the numbers, and we'll continue to become more knowledgeable about it, and we will be in a better position to act when it becomes necessary, whichever way we go.
very sad news that a Victoria County resident had passed away after contracting the virus out of state, or out of county rather. How do we track county residents who get sick out of the county, and how do we have, kind of an accurate estimate for how many folks it affects who live in Victoria County?
I guess that's probably a question better suited for Dr.
Right.
McNeil or David. I do know that we should have been notified earlier than what we were about that fatality. That actually occurred, I believe it was on April 1st, if I'm not mistaken.
It was several days before.
No, I'm sorry, it was late. It was far too much time passed before we were notified. We should have been notified earlier, but in terms of the mechanics of how that's relayed to us through the state, I would have to defer to Dr. McNeil.
But at this point, does it appear we'd only get a notification if there were a fatality, not if, a resident went out of the county to get tested and that medical center had a positive? Would they notify us just then?
They should.
Okay.
They should. And I say should because throughout this, that hasn't always happened, but it should. They should be reporting those numbers to us. I can't speak to the exact mechanics of that, but certainly with that fatality for us being notified so far after the fact, that was an oversight somewhere.
But you have to look at that in perspective too. We don't know the circumstances of what was going on at that other facility. They may have been up to their neck in taking care of patients, and the last thing on those people's mind was giving a report. I hate to put it that bluntly, but that's probably a reasonable explanation of why some of this information lags. And I'm never going to question those that are taking care of our sick among us to criticize them for not getting a report in by the end of the day when they've had a tough day. So that's part of it. But the thing is, it has to go through a process. There's investigations done, and before it's determined, that's when it's usually made public, is my understanding of the process.
Now,
Yes, ma'am.
I am, hearing clearly that everything is very fluid. We do
Very
know
much
that,
so.
yes, and we do know that Governor Abbott will be speaking on Friday.
Mm-hmm.
In terms of Friday, he'll be speaking.
Mm-hmm.
What about for city officials? Do you guys have a timeline for when you want to sit down, and publicly announce some of the steps that you want to wait till May 1st, or are there some things that you're going to announce along the way?
Sure. Well, the question is the press conference Monday, how quickly will that impact our any local changes we make, any decisions? We'll begin reviewing and analyzing whatever is announced immediately. I know that I would presume that would be earlier in the day because we have a conference call with the governor's office later in the day on Friday. We'd begin looking at whatever it is that is announced. Certainly it takes time to decipher a lot of what comes out. So I couldn't give you a time frame on when we would be applying that to a local order. The local order we have in place goes through April 30th. Certainly we could implement something new prior to then. And so that may well happen. I don't have a timeline on that.
Mayor, Judge, just briefly, on Monday, Dr. McNeil had said that we likely have not reached our peak here in Victoria County. Of course, still to be seen what that peak will look like, if it will be very dramatic or not. But most public health experts say that once we start reopening communities, economies, communities really need to have enough capacity to test widely and to do contact tracing so that when the virus reemerges, it can be contained. Do we think that we have enough of those capacities here, for when we start to open things up again?
Well, I think the numbers speak that we're far ahead of most people in testing, so I would have to assume that we would have those capacities, and I think there are new testing coming online on a daily and weekly basis. So we'll see how that looks. But the facts before us are we have been testing at a far greater rate than most people.
And I'd follow up with that, Kira. As we contemplate doing something different, those are specific questions we would be asking our epidemiologist, Dr. McNeil, our health director, what their thought is on that. How could this impact their ability to do contact tracing with limited staff, which is what we've been doing all along, seeking their advice and feedback. And we'd continue to do that with any new decision that we contemplate. Anything additional? Looks like that's it. Okay.
Thank you.
Very good, very good. Well, again, we appreciate you all being here, certainly for those tuning in online or at home. The source for the most accurate, up-to-date information continues to be victoriatxoem.org, the Facebook page of the Victoria County Public Health Department, or via the COVID-19 hotline, which is 580-5796, and will continue to be operated from 8 to noon and then 1 to 5 Monday through Friday. Fox 19 will be replaying this briefing at 10:35 tonight. Suddenlink Channel 15 or 115 at 6 p.m. this evening. And these briefings are recorded and also aired on Kicks, Q92, Jack FM, Club, and it looks like those stations. For anyone with unmet needs, 211 is the number you continue to be able to call, 211 for local unmet needs. 24/7 statewide mental health support is available at the phone number 833-986-1919. Again, that's mental health support 24/7 statewide by calling 1-833-986-1919. Again, going forward, we'll be doing these Monday, Wednesday, and Friday. The next one, of course, will be Friday at 3 o'clock. And we, again, appreciate your attendance, and we will see you all soon.
And if I may add one note, if you want to look at the state numbers that we look at, you can go to the Texas Department of Health Services website, and they have information that I call the equivalent of the Johns Hopkins site worldwide and nationally. Okay, thank you.
Very good. Thank you all.